First test that I will do is the Thomas test, and this is for hip flexion contracture. So what I will do, I will place my hand underneath my patient, under the lordosis curve. And what I will do is I will flex this leg and push down. Let me move this a little bit. So I will flex this leg, push it down. A positive sign would be if this leg were to flex slightly. So if it did, what I would do is I would try to push this back down and check for motion in the lordosis curve, and if it is increased, that is also a sign for hip flexion contracture. That second part would be done if the first part was positive. Second test is the Kendall test. I'll have my patient come off, bring his knees off the bed. He will lay down. If this is his effective leg, I will have him do is I will have him flex this leg and bring it to his chest. If this leg were to extend, that would be a positive sign for rectus abdominis contracture. If it were positive, I would palpate the muscle. If there were no palpable masses, that would indicate IT band tightness. Could also indicate, if his leg were to adduct, that would indicate IT band tightness as well. If his leg were to adduct, that would indicate IT band tightness. If there were no palpable masses, that would indicate a damage to his capsule or his ligament. Next test I will do is the piriformis test. So I'll have my patient lay on his side. So lay on other side. And what I'll do is if this leg is the affected leg, I will flex that leg, flex his knee. I will then support his hip and push down on his knee. If he feels pain there, that would indicate piriformis injury. If there's pain in his hip or buttocks, that would indicate piriformis injury. Or if there was pain in his buttocks or posterior thigh, that would indicate sciatic nerve impingement because of the piriformis tightness. And finally, we have the Trendelenburg test. So, stand up, face that wall. If we say that his right leg is the affected leg, this test is testing for gluteus medius weakness. So what I will have him do, I will have him lift this leg, other leg, this leg. And I'm looking to see if his hip were to fall, and if that were the case, then that would indicate a weak gluteus medius.